Lenny, the Bongo Hive team, as well as the IHM team. You guys are required to introduce yourselves so that everybody can get to know you guys, even as you will be running us through the Q&A. So we'll start with the Bongo Hive team. Mapalo, please briefly introduce yourself, and thereafter we'll go to Lenny and Mwaka.
Hi, everyone. My name is Mapalo Lukashi, and I am the Data and Partnerships Lead at Bongo Hive, as well as also an Entrepreneurship Associate on the Entrepreneurship team. I'm excited to be on this call and getting to meet all of you. Thank you.
Hi, everyone.
Okay, perhaps. Oh. Please go ahead, Mwaka. I'll introduce myself after you.
Hi, everyone. My name is Mwaka Souza. I'm the multimedia designer at Bongo Hive.
Good afternoon. Let me see if I can have my camera on just real quick. I don't have the nice background that Mapalo and Mulemwa have. My name is Lenny Mumbi, and I'm the marketing and communications lead at Bongo Hive. Basically, I manage the marketing and communications for the Bongo Hive group of companies, which includes Bongo Hive Consult and Hive Co-working. I'll probably be in the background for this meeting, just assisting with some questions or clarifications that will come through via social media. And looking forward to a very informative session, and all the best to everybody on this call. Thank you. Bye.
Good afternoon, everyone.
Thank you.
My name is Parit Chizela, and I'm an Innovation Associate at Bongo Hive.
Parity, please confirm if you're done. I can't hear you anymore.
Oh, yeah. Were you able to hear me?
Now I can hear you.
Oh, okay. Then let me just reintroduce myself. Good afternoon, everyone. My name is Parit Chizela, and I'm an Innovation Associate here at Bongo Hive.
Thank you. Thank you for that. I will now hand over to the IHM team to briefly introduce themselves. Over to you, Sam.
Good afternoon, everyone. I hope you can hear me. My name is Sam Musaviri. I am with IHM.
Recording in progress.
Sorry. All right, sorry about that. So I'm with IHM, spearheading this initiative with Bongo Hive. Nice to meet everyone virtually. Thank you.
Thank you.
Yeah, everyone. Hope I'm loud and clear. This is Henry Osamba from IHM, the project officer. I'm also helping out with coordinating the digital health hackathon. Thank you.
Thank you. Do we have any other representative from IHM?
I don't think so.
Okay, all right. Thank you for that. At this point, I will hand over to Mapalo, who will walk us through and give us more information about Bongo Hive and the work that we do. Over to you, Mapalo.
Thank you so much, Mulemwa. And it's great to see everyone on the call and where you're joining us from. I think we have people all the way from the Copper Belt. We've got people from Lusaka, Chiengi district. It's exciting how such great thoughts and great programs can bring people from all across the corners of Zambia. And that's what excites us as well as Bongo Hive. And Bongo Hive, just to give you a brief background through our name, Bongo Hive comes from two words, three if you are being very accurate with syllables. And the first one is Uongo, which means the brain, right? So obviously to connote thinking, ideas, thoughts, and beehive. I believe if you have gone through school, you might know what a bee is. It's an insect that is very useful to the ecosystem in terms of building of it kind of creates honey, which is very nutritious at the same time. It's really helpful for trees because it's a big part around pollination. So it's also very key that bees stay alive because they really help with the continuous growth of our maize and everything like that. So Bongo Hive comes from those two words, and Uwongo meaning the brain, and like I've said, and when we were putting together our logo, there are two things that were very key, and that was that we are a place where great minds come together, to build something sweet that changes the world, right? And that's where we come and have our vision and our mission embedded into such lines of thought. We really want to see great minds like yours come together, and be able to say, how do we build things that are sweet that will change the world? And we believe through partnerships like the one we have with IHM, it's great to be partnered with IHM as we unroll this, is to be able to see how we can have these great minds that we know our country has, Zambia has, be able to put these ideas into a place that can change the world. And maybe you can just help me, Mulema, by changing the slide. So when it comes to the work that we do at Bongo Hive, we do work across four major rails. The first is the knowledge rail, and which today we're really engaging from the entrepreneurship side. So the knowledge rail is where we do a lot of communication in terms of skills training and being able to build entrepreneurs that are thinking right, have the ability to pair their problem to their solution, their product to the market, to help you go through that process of being able to develop your product. And that requires learning. It requires a change in mindset. It requires you acquiring certain skills. But then we didn't stop there. We said, okay, we need to go a step further. So Bongo Hive, we also have Bongo Hive Consult. This is our tech side in terms of what we do. We have got a lot of developers on the Bongo Hive team. Actually, the majority of staff are actually developers, coders, programmers, depending on how you want to call them in general. And here we try to bridge the gap between just having the knowledge to being able to create actual solutions in the tech space, right? So prototyping, being able to help our startups get to a place where they can build their MVP, which is a minimum viable product. And then we also go further with our physical infrastructure rails, with our Hive co-working. If you don't know, maybe today's a great time for you to know. At Bongo Hive, we do offer Hive co-working space to startups, and you can reach our co-working team and they'll be able to guide you on the spaces that we have, from just sitting, that is what you call hot sitting, to dedicated offices, to dedicated desks. Last but not the least, Bongo Hive also has a financial role in Bongo Hive Ventures, and we're currently raising a massive fund in the millions of dollars, so we can be able to pump that money into startups that run through our programs and see them raise more finances. So this is pretty much what the work that we do at Bongo Hive, and we are very excited to be able to get to hear from different people on our programs, just to get in touch with some of our groups of companies at Bongo Hive. Thank you so much. Looking forward to the session. Over to you, Mulemo.
Thank you so much, Mapalo, for that brief overview about the work that we do at Bongo Hive. I hope everybody now has a good idea of the work that we do at Bongo Hive, and that you will collaborate with us in one way or another. And and also through the hackathon, of course. So at this point, I'm pretty sure many of you are wondering what the hackathon is about. Some of you already know, and some of you just have an idea and would like to have a better understanding about the hackathon, about what it intends to achieve, and just so that you can have a better application even as you begin the application process. So allow me to hand over to the IHM team, to Sam, to take us through what the Digital Health Hackathon is all about. Over to you, Sam.
All right, thanks, Lemo, and thanks for the introduction. I think I'll start off with an introduction first and foremost of IHM. So IHM is a social enterprise. The full name stands for the Institute for Health Measurement, Southern Africa, which has been around for close to 10 years. I'm mostly focused around working with governments, or at least in the social health enterprise space, particularly looking at digital health, health informatics, and health information systems. So in that regard, our work usually centers around supporting governments, organizations, donors with implementing digital health information systems. About 2-3 years ago now, we were privileged to be awarded the project to manage smart care for Zambia. This is a project that is financed by the US government, specifically through PEPFAR and CDC. And the project itself is called Strengthening Capacity for Health Information System Sustainability. A bit of a mouthful, but in short, we like to call it SKIS, the SKIS project. So with this particular project, the goal really is to scale smart care, and I'll talk a bit about smart care. And in scaling smart care, we are particularly looking at increasing, obviously, usability by creating this optimal electronic health record, which is being used primarily by healthcare workers, but obviously has got other users, specifically referring to data consumers like the government, as well as other partners. In addition to this, part of the work around SKIS involves the usage of data. So as you can imagine, smart care is deployed in roughly around 1,600 facilities, which is slightly over 50% of the total public health institutions in Zambia. So as a consequence of that, there is obviously a lot of data being generated. And part of the work that we're doing is to now harness that data, use that data for informing purposes, as well as to provide different stakeholders with this key information to empower them to make the decisions that they need to be able to make. Part of also a very key focus rather of the project is to ensure that we do build that capacity within government for them, because really this is their system, it's their work, and the clients that they serve are obviously Zambian citizens. And really is just to work with government, build capacity for government to obviously then take up the system eventually. So I thought that background would be important, just so as to paint a context, which is a good segue now into why we're having the digital health hackathon. So one of the issues I think that typically comes up with smart care and the smart care story is, for one reason or another, a lot of people have wanted to get involved with smart care. It's obviously been the backbone of the digital health systems in Zambia. And we thought, as IHM being in this privileged position, working on behalf of government or working with government, supported by PEPFAR and CDC, is we are very aware that we are not the sole custodians of the best ideas in this space. And we wanted to be very purposeful in opening up this space and then inviting in a very official way other innovators and people who probably even have better ideas and better ways of executing this. So this whole this whole hackathon really evolves mostly around smart care, which is government's electronic health record, like I've already mentioned. For those that may not be very aware or very acquainted with the healthcare space, an electronic health record would be akin to your core banking system. If you've been in the banking sector, when you go to your bank, either to deposit money, to withdraw, all those transactions are being supported by a core banking system, which then obviously keeps your name and is able to facilitate all these transactions that you have to do. So it's the same thing in healthcare. We have this electronic health record that is used by healthcare workers across Zambia to attend to patients. Doctors, nurses, pharmacists, different clinicians are using the system to then attend to their patients and use the system really to do the different aspects of their work. So whether that's registering a patient, whether that's taking vitals, and vitals in this case refers to your blood pressure, your temperature, whether it's now attending to the patient, whether it's prescribing and dispensing medication, whether it's ordering lab tests, fulfilling lab tests, that entire business workflow happens within smart care. So as I mentioned, the goal of the hackathon really is to then say, we want to then connect with the brilliant minds which are out there, and we're grateful to Bongo Hive for their willingness for them to work with us. And we're also grateful for everyone that's managed to jump on the call today, just to make time from your busy schedules to hear about the work that we're doing. And we're really excited because we do know that the minds that are out there in the different organizations, whether you're a freelancer, you're in school, you're a developer, you're a healthcare person, we know that there's a lot of brilliance out there. And really that's what the hackathon is aiming to do, is tap into that brilliance, give you the platform to be able to bring that innovation to life. And obviously with a lot of the innovations that sometimes we see is because they lack a backbone. You will find that an innovator comes up with something and unfortunately it can be rooted. But hopefully what we aim to do with this hackathon is to harvest those ideas and have them implemented within smart care over the period, over a period of time, so that eventually that innovation, that idea that you have, I'm sure as we proceed, we'll open it up for question and answer. But briefly, that's an overview on IHM and the background of the Digital Health Hackathon. Thanks, Mulemwa, and I'll hand it back to you.
Thank you so much, Sam, for that overview. And I'm so glad that the IHM team, as well as the different partners that you guys are working with, have chosen to tap into the innovative minds that we have in Zambia. And I look forward to seeing the different innovations that will come out of this brilliant digital health hackathon that aims to make the health system better, the health sector better. So at this point, we will move on to our next segment of the program, which is the challenge statements. So like I said before, the challenge statements are the bedrock of the hackathon. So your solutions, your innovations are innovations that are meant to be responding to the challenge statements that have been provided for each and every one of you that would choose to apply for the hackathon. You will see, if you've already started the application process, that there's a segment where you are required to pick one challenge statement that you feel you have a solution for. So allow me to hand over to Parity from Bongo Hive, who will be running us through the challenge statements. Over to you, Parity.
Thank you, Mulemwa. So the go to effective problem solving is clearly defining the problem. When we clearly define the problem, we know what challenges lie ahead and we know what exactly we have to do. So by using challenge statements, we have the opportunity to clearly define the problem and also to set objectives as to what really needs to be achieved, yeah, as we are trying to find solutions to the problem that we have. So without taking much time, let us go straight into the challenge statements that we have for the Digital Health Hackathon. So if you notice here, we are having a problem statement, and we are also having a challenge statement. So knowing the problem is one thing, and having a problem statement that helps us to refine that problem is another thing. And a challenge statement now challenges us to see how best we can solve that problem. And if you notice, there are some personas that have been included there, like a fictional representation of the person we are trying to solve the problem for. So allow me to read the first challenge statement, which is enabling patients to access their medical records. So the problem reads, a significant challenge in the healthcare sector is patients' limited access to and sharing of their complete medical records, often paper-based. This hinders doctors from different hospitals from providing comprehensive care, potentially leading to inadequate treatment and impeding informed health decisions. Patients face difficulty sharing records across hospitals, limiting new healthcare providers access to essential information and making accurate diagnosis and appropriate care challenging for unfamiliar doctors. Additionally, this lack of access to complete medical histories hinders patients' ability to make informed health decisions. So the problem statement, John, a 29-year-old male, faces challenges in providing complete medical histories to different doctors, which can lead to suboptimal treatment and limit his ability to make informed lifestyle choices. The challenge statement, how can we empower patients like John to access their medical records and share easily with other stakeholders to enhance their healthcare experience, or also enabling them to make informed health decisions about their health? Yeah, so if we look at the problem here that we're trying to solve for John, yeah, you'll see that if John goes to a hospital that is maybe in Lusaka today, and the next day goes to a hospital that is maybe in Kitwe, John will not have accurate knowledge about his medical history and his condition. When he's being treated by another health personnel, the health personnel would not know where to pick it up from, because it might be difficult for him to tell just by hearing from John, or just by having maybe a few paper-based records, which might be misplaced or which John might lose. So with this challenge, we are trying to solve this problem by empowering John with access to his medical records, whereby John can be able to see his medical records maybe on his phone when he wants to, or he can even show it to a doctor if he goes to another healthcare institution. So Mulemo, can you please help to move to the next slide? Okay, thank you. So the second one reads, capacity building for data analysis and research. So the problem, the healthcare sector is increasingly generating vast amounts of data through electronic health records. This data has the potential to revolutionize healthcare by providing insights into patient care, policy formulation, and areas of health research. However, the underutilization of this data due to challenges in access, ownership rights, and system availability, especially in remote areas, has limited the opportunities for enhanced healthcare. Additionally, there's a need to harness the power of modern data analysis tools and methodologies, such as Stata, R, Python, predictive analytics, and machine learning, to derive meaningful insights from this data. The problem statement, the electronic health record has over the years collected a vast amount of data which can be effectively analyzed and insights gathered for policy formulation, enhanced clinical management, and also areas of health research. There is a need to demonstrate robust data analysis for insight generation using the latest methodologies and tools like Stata, R, Python, as well as deployment of predictive analytics and machine learning to enhance healthcare outcomes. The challenge statement. At Chikando Clinic in Chipata, Mrs. Banda works as a devoted clinical officer with 5 years of experience using an electronic health record system. Her passion for public health is evident, yet she faces challenges in deciphering valuable insights from the electronic health record regarding a community's health patterns, believing that the appropriate tools and access can lead to groundbreaking enhancements in healthcare. How can we fortify both her and our clinic's proficiency in harnessing electronic health records, advancing predictive analytics, and uplifting the standard of healthcare delivery? So, since we have a lot of software developers here, we can put it this way. They say data is the new oil, right? Yeah. So when you look at it, the health records that we currently have can actually be used to generate insights that can help us to prevent some diseases or some disease outbreaks or even other conditions. And they may also help in policy formulation, in that if we have all these health records, we might be able to get to analyze that data and get patterns on what is changing and why it is changing. For example, in a certain area in Lusaka, you might find that a whole lot of people are having diarrhea at the same time. When you notice that pattern, you can tell something is wrong in that area. Why would a whole lot of people be having diarrhea just in one area? Why not other areas? So such insight can help us to come up with solutions and interventions before the problem can actually become bigger. And the same may happen with at clinics where if somebody is providing, if a healthcare professional is providing information regarding certain diseases or conditions, the system can actually learn from that and be able to advise that person maybe on why that might be happening. Mulema, can you help to the next slide, please? Okay. So interoperability and secure ecosystem collaboration. Problem. Inadequate system integration and interoperability within health information systems have led to fragmented inadequate system integration and interoperability within health information systems have led to fragmented data, inefficient workflows, and limited access to comprehensive patient information, reducing the potential to harness healthcare data for enhanced healthcare provision. Different stakeholders and public health organizations in the digital health ecosystem tend to work in silos, though this has reduced over the years. Problem statement. Healthcare organizations struggle with fragmented health information systems, resulting in inefficiencies, reduced opportunities for health enhancement, thereby reducing positive impact for healthcare outcomes. Challenge statement. How can we enable seamless system integration and interoperability within health information systems to ensure timely access to accurate patient information across different systems, enhance workflow efficiency, improve data security, reduce healthcare costs, and promote collaboration within the healthcare ecosystem for comprehensive patient care? So with this one, some people might notice that if, let's say, you go to a hospital here in Lusaka, maybe one private hospital, you might find that they are, of course, using some digital tools, they're using some systems, everything is being documented on the computers, but when you go to another hospital, you start over. They'll have to collect the same information over again, which means that other hospital is not having your information. Again, if a doctor that has diagnosed you is in hospital A, that is maybe in Chilenje, and then you go to maybe hospital B, that is maybe in North Mid, you'd find that if they weren't able to treat you that side to hospital A, you go to hospital B, they are also using systems. There won't be that communication between these systems. All that information is just being kept at that health institution. So now, how can we ensure that there's a provision in which these different hospitals can securely share that data that they are generating, that they're collecting from the patients? They can share it in such a way that these systems can communicate, maybe through some universal standards. How can we ensure that they are able to communicate so that we can enhance patient care? Next slide, please. So adoption of artificial intelligence and telemedicine. So problem, the healthcare sector is facing difficulties in providing timely and accessible healthcare services, especially in remote or undeserved areas with limited specialist availability. This results in delays in diagnosis and treatment. Problem statement, the current healthcare sector is struggling to keep up with the growing demand for medical services, especially in remote regions. This results in limited access and delayed care. Challenge statement, how can we leverage artificial intelligence and telemedicine technologies to expand healthcare access, enhance medical consultation efficiency, and ensure prompt diagnosis and treatment, especially in remote areas? Yeah, so with this one, remote areas usually don't get to have many specialists. But what if we have a specialist maybe in Lusaka who's able to assist in some way in collaboration with the healthcare personnel that are in that remote area? On top of that, how can we also utilize artificial intelligence to provide healthcare in these remote areas? Next slide, please. Okay, improving training and knowledge of electronic health record systems. So problem, in order to successfully implement healthcare technology platforms such as the Smart Care Electronic Health Record System, healthcare professionals must be proficient in their use. However, a lack of comprehensive training and support leads to difficulties in adopting and utilizing these tools, which limits their transformative potential. Problem statement, healthcare organizations struggle to provide effective training and technical support, hindering staff from adopting healthcare technology platforms and maximizing their benefits. Challenge statement, how can we develop and implement a comprehensive training and technical support program that empowers healthcare professionals to proficiently use healthcare technology platforms, ensure efficient integration into their workflows, and maximize the impact of these technologies on patient care and outcomes? So as things stand, you'd find that in some hospitals or clinics that have electronic health record systems, there's usually some sort of rejection that comes from healthcare personnel. Some healthcare personnel might think maybe it's difficult to use these systems, they can't easily use it. They might think they are not technically proficient to use computers or to use this system in any way. So how can we try and provide training that makes every health personnel to be confident to use these systems in all hospitals and clinics? Okay, thank you. Last slide, please. Oh, okay, yeah, I think that is all. So these challenge statements will get to help us to specifically target a certain area of these problems. So I'm wishing you all the best. Thank you. Malema, back to you.
Okay, thank you so much, Parity, for running us through the challenge statements. It's more clear now, and hopefully our applications will be better now that we know what the challenge statements are about and what they're expecting us to provide in the application through the challenge statement. So at this point, I will take us through the application form. Just give me a minute. Okay. So for those of you that have already started the application process, I'm sure you are familiar with some of these questions here. So as you click on the link that's been shared over the past few days on our different social media platforms, you will notice that the link directs you to our website that gives you more information about the hackathon, the prizes that will be given, the expertise that will be shared, as well as important timelines to take note of. And then once you click on the apply button, you'll be directed to this application form, where we will now begin to ask you questions to see if you're a good fit for the program. So the first chunk of questions that we'll ask you are questions on your personal details. So we'll ask you for your full name, your age, your gender, your nationality, your date of birth, your email address, your phone number, alternative phone number in case we're not able to reach you with the number that you will provide. And in the event that you are applying as a team, we always encourage the person that's very active, first of all, the person with an active phone number, an email, a person with a responsive email and phone number to be the one to apply. And also the person with a technical background. I'm sure some of you have already formed teams, and maybe one or two people on that team have a technical background and then the others don't. So we encourage the person with the technical background to be the one to fill out the application form, because there are a lot of technical questions that we ask regarding your proficiency in certain skills and things like that. So it's best if the person with the technical background applies. And then after your personal details, we'll ask for your educational background. So we want to know what your highest level of education is. And we're aware that some of you are students. So if you're a student, what institution are you at? And what's your current field of study? All that information is relevant. And then we'll get to the professional background. So this is what I was referring to. We will ask if you're a software developer. We will ask the number of years of experience you possess as a software developer. We will also ask you to describe your technical skills and expertise, including any relevant programming language and frameworks that you are very familiar with. And we want to know the relevant projects that you've worked on. So when you're applying for this particular program, please don't be humble. This is the time to shine and let us know all the amazing work that you've been doing, or the projects that you're currently working on. It could be a school assignment a school project that you're working on. That is also relevant experience. So don't shy away from telling us all the amazing things that you're doing, because that's what we want to know, and we want to pick the best of the best. So it serves you well if you put out and share with us all the amazing things that you've done or have worked on. Yeah, so based on that, we'll also ask you to share links to your previous development projects or repositories if available. So if you have links to these things, it's always nice to share that information with us so we can also review it, because this gives us confidence that you're actually working on stuff, and it gives us a good impression of the type of innovator that you are. So it's always good to attach links to some of the things that you've worked on. And then we also like to know if you've participated in any hackathons or coding competitions or similar innovations before, just so that we know if you have experience. That's usually an added advantage. So please feel free to include that information there. And then the next section that we have is your company details. So at this point, so I'm aware that some of you are applying as individuals, some of you are applying as a group of people, but then there's also another set of people that are applying as a company. So you have a registered business and you'd like to apply for the hackathon. So this section is very necessary for you if you are applying as a business. So the first thing you do is you list the name of your organization over here. You tell us the stage of development you are at. Is it idea stage? Is it post-launch but pre-revenue? Is it post-launch with revenue? All that information is relevant. At this point, you also tell us the role that you have in that business that you're currently running, and would like to gain more information about the company. So you provide a brief overview of your company in this section here. And then after you fill in that part, the next section that you will go to is your problem solution fit section. So as Parity mentions earlier, the bedrock of the hackathon is the challenge statements that he ran us through. So your solution is supposed to respond to the challenge statements that have been outlined. So you select one challenge statement that you'd like to respond to, as well as the solution that you have to that challenge statement. So ensure that your innovation is in line with the challenge statements that we aim to address for this particular hackathon. Thereafter, would like you to describe how your innovation aligns with the outlined challenge statement. So here we want you to tell us why you are the best fit for the program, like why you and not anybody else. So you provide more information about your innovation. What is your proposed solution? So on this particular question, we want you to tell us the features that your solution will have and let us know how it will work. So you give detailed information about these two things that I have outlined. And then thereafter, we want you to tell us your unique value proposition. How is your solution different from any of the solutions out there? What makes your solution unique? So we want you to shed more light on that, give us more information about your solution and how it's different from the innovations out there. What makes it unique is what you'll be sharing with us in this question. If you have any links or videos or product demos that explain how your product works, this is the part where you attach that. Some of you might have already started working on product demos for the solution that you intend to showcase for the hackathon. So this is the part where you attach that and to give us a better understanding of how your product is supposed to work. So this is where you attach that. And then we also ask that you share any traction that you've made so far or research you've undertaken. So maybe you've interviewed a few people, maybe you've spoken to people in the health sector about this, or maybe you're currently carrying out a project in a similar field. So this is where you share that. You want to know any significant progress that you've made so far. So feel free to share that here. And then lastly, we'll get to the section where you tell us about your team. So if you are applying as a team, we want to know how many people are on your team. We want you to tell us what are the roles of the members of your team. And we also want you to tell us your teammates' educational background, their career backgrounds, the skills that they have, and how many years of combined experience you and your team have. So we want you to share all that information with us so we can have a better idea of the team that you are. And then lastly, we want to understand what inspires your dedication to healthcare innovation and what motivates you to contribute to this field. Why are you applying? Like, why the health sector, not anything else? So shed more light on this. And then we also want to know if you've participated in any healthcare related projects or initiatives in the past. Maybe you've participated in a health hackathon before or anything in that regard. This is a part where you share that information with us. And then we'd also like to know where you heard about the program from. Was it LinkedIn? Was it Instagram? Was it through a friend? Was it through our newsletter? Please do share that information with us. And then we would also like you, before you click the apply button, you have to ask yourself if you'd be available to attend all the program sessions, because if you're picked for the program, you will be required to attend all the program sessions. So if you feel like you will be available for that and you're very sure that you will make the time regardless to attend the sessions and participate in the hackathon, you will click on yes to the terms and conditions and then apply. So this is the application form. I hope you guys have already started applying. And if you haven't yet already done so, we hope that you will be able to apply with the knowledge that you gain from this information session. At this point, I will open the floor to any questions that any of you might have. And the IHM team, as well as the Bongo Hype team, will be able to address those questions. I see that Rachel has a question. So Rachel, feel free to unmute your mic and ask your questions. And in the meantime, Lenny, please be on the lookout for questions on our Facebook pages and our LinkedIn. Rachel, go ahead.
Thanks for the nice presentation. I wanted to find out if, for example, the person who is applying is not a software developer. I've seen there's a question for software developer. If you're not the software developer, but there is someone on the team that is a software developer. So I don't know how does that work?
So you said you have a team member that's a software developer, but then the person applying isn't a software developer. Am I correct?
Yes, please.
Okay. So like I said earlier, we encourage the person who's the software developer to apply, because if you've noticed, majority of the questions aim at understanding the technical expertise that the software developer has. So in order for you to be able to fully answer those questions, it's best that the person that's the software developer be the one to apply, and then the rest of the team can support in the other areas as well.
Okay, thank you.
You're welcome. Does anybody else have a question?
So you can apply even if your business is not yet registered, or it's only for registered businesses?
Yes, you can. Sam, you have your hand raised. Please go ahead.
Thanks, Malema. So just to add as well, especially if the majority of our participants are developers, and you feel you might need adequate context on the healthcare space, we're also happy to connect you or add a healthcare person onto your team, or at least propose, and then you could meet with them and see who you can work with. So that's something that we're also happy to help and facilitate. Thank you.
Thank you so much for that. I see that there's a question in the chat. So George is asking if remote participants are allowed. So all the sessions for this hackathon will be physical. So we'll have a sprint day where we get to run you through the different stages of development, and that will be happening in person. So you'd have to be able to attend that. So yeah, you have to be able to attend that physically. Does anybody else have a question? Please go ahead, Cassie.
Thank you very much. My question is just based on your last answer. For people who are not in the country but would like to contribute to like solving these big problems, do you have any, like, does Bongo Hive have any like plans for this, or like to leverage sort of skill sets that are not physically in the country but people would like to contribute? Thank you.
For this particular hackathon, right?
Might be this hackathon, could be anything, just Bongo Hive in general. I mean, based on your last answer, we can't contribute now, but like maybe in future possible.
Okay, so we do have quite
that's me, Malema.
Okay, please go ahead.
So just to respond to that question, thanks for asking it. So we have worked with people on occasion who are out of the country, but it's worked better when they have a team here. So maybe if you have, say, a co-founder in the country and you apply for one of the programs that we are hosting, it could work out, because then you've got some physical representation. As to answer your question on whether we've done a project that's completely remote, there are some of those, but there are fewer than the ones which require physical presence, at least at some point in time. So you might want to work around seeing if you have got some physical presence, maybe through a partner that's at least can make it for a physical meeting. That's one thing I'd advise.
Great. Thank you very much, Mapalo. Appreciate it.
Thank you for that, Mapalo. Robson, I see you have your hand raised. Please go ahead.
I noticed when you are taking us through the problem statements and the challenges, there are some, let me say there are a number of challenges. As a team applies, do we have to look at all those challenges comprehensively, or we can focus on one challenge for an application?
So you can focus on one challenge statement that you'd like to address for the application. Because in the application form, you'll be asked to only pick one. I hope that helps.
Okay, thank you. That's it.
You're welcome. Does anybody else have a question?
Can I ask just a follow-up on that question? Sorry, Zanga here.
Yeah, please go ahead.
All right. Maybe I'll give an example of an application, the MedSearch Zambia app, and more like two of the problem statement is what we're trying to solve. So I don't know, should we now focus on one and leave the other one, or we can still go with the same one?
Okay.
Are there any exceptions?
Team, what are your thoughts on this?
You should have your core focus. One of the things we would advise is that even if your problem is solving, your solution is solving two problems, there needs to be that core problem that you're trying to target, right? It's better to go with a focus approach than to be all over the place. Not saying that your solution cannot solve another problem, but it must be clear what your major focus is on, because we'll be able to score you especially towards that. So that's what I would offer as advice. There should be that clearly identified problem that you say, okay, this is the core, and these are other things that our solution is also solving. But make sure you have a clarity on which one is your core focus.
Thank you, Mapalo, that comprehensive answer. I hope that helps. Do we have any other questions? Okay, Chipo, please go ahead.
Hello, can you hear me?
Yes.
Okay. Yeah, so just one thing that confuses me from the application form, I think the impression is there's already something that exists. There's that. And are we writing about the application, or are we developing the application and writing about it?
Sorry, can you ask your question again?
Okay, I'm saying from the application form, there's the impression that I'm getting is there's already, let's say, the participants, the applicants already, they already have developed a system. Okay, there's that. I don't know. Perhaps you can provide more information on that. Then the other thing is, I'm not sure if we have to write about the application, like what it does, the application, more like an idea. Are we submitting an idea, or we're creating an application and writing about it? I don't know if that's clear.
So some teams already have ideas that they are currently working on. And then there are some people that are building ideas from scratch. So it really depends on the type of the stage that you're at as an innovator. But what essentially we're trying to do is that you are trying to create solutions to the problems that have been identified with the challenge statements that have been given to you. So you are responding to those challenge statements that we've listed out.
So does that mean that you're not required to build anything?
You will be building something.
Now, is
during
it
the hackathon.
now? Is it now or later on?
Later on, in the later phases of the program.
Oh, all right.
Yes.
All right, thank you.
You're welcome. Does anybody else have a question? Is there anything you need clarity on? Feel free to ask. So that even as you begin your application, you will be confident enough to fill out the questions and put your best foot forward. Lenny, do we have any questions on Facebook?
Thank you, Mlema. No, there are no questions.
Okay. Okay, I see a question in the chat. So Kanai is asking how long the building will take place. So if selected, you will be given 2 days to build on your innovations based on the knowledge that you will gain during our sprint day, as well as the guidance from our experts from the IHM team, as well as the different partners that are on the program. Okay, going once. Are we all good? We don't have any other questions? Okay, okay. Okay, if we don't have any other questions, we can move on. So next steps, the applications will close on the 30th of October, 2023. So please ensure that you complete your applications by then. And then thereafter, applicants will be notified of the application status on the 10th of November, 2023. Successful applicants will then proceed to Sprint Week, which will be from the 21st to the 24th of November. And then on the 24th of November, we'll have Pitch Day, where the selected innovators will get to pitch their innovations to a panel of judges. And then the top 3 innovators will walk away with different cash prizes. So the first prize will be 80,000 kwacha. The second prize will be 45,000 kwacha. And the third prize will be 25,000 kwacha. So all the best to everybody that will be applying, and please ensure that you comprehensively answer the questions so that we critically review your application and to increase your chances of being picked on the program. I will hand over to Sam. Do you have any last words or any closing remarks before we end the program?
Not really, but I just want to say thanks for first to Bongo Hive for facilitating for this, and also to the people that have expressed interest. If you've got any questions, please feel free to reach out. I'll be more than happy to assist you.
Thank you. Thank you, Sam. Okay, thank you, everybody. Thank you so much for finding time out of your busy schedules to join this information session. We hope you found it insightful, and we hope that all your questions have been answered, and that from here on, you will begin your application process if you haven't already done so. And if you have already begun your application, that you will be now able to finalize it and submit it before the 30th of November. All the best, and please put your best foot forward in your application. Tell us all the amazing things that you are doing. Thank you.
Thank you.
All right. Thank you. Thank you, everyone. Bye-bye.
Bye.
Thank you.
Bye.